Imagine a serene morning. You're making coffee, the sun rises, and you can't seem to find your favorite mug. This small, frustrating moment can symbolize the early stages of dementia for many. Meet Margaret, a lively 72-year-old who adores gardening and baking for her grandchildren. Recently, she has begun forgetting simple things. Where she placed her keys, the names of plants she has tended for years, and sometimes even the recipe for her famous cookies. For Margaret, these moments of confusion and forgetfulness are more than just aging. They signal the early onset of dementia. Dementia is a collection of symptoms affecting memory, thinking, and social abilities severely enough to interfere with daily life. Unlike the normal cognitive decline associated with aging, dementia is caused by significant brain changes. These changes can deeply impact the lives of those affected and their loved ones, bringing about a mix of frustration, fear, and sadness. This story of Margaret and countless others highlights the emotional impact of dementia. It disrupts not only the lives of those diagnosed, but also their families and friends. It's essential to understand that dementia is not a normal part of aging, but a serious condition resulting from various underlying brain disorders. To comprehend dementia, we must first explore the remarkable complexity of the human brain. Visualize the brain as a bustling city at night, with millions of lights flickering on and off. These lights represent neurons, brain cells, constantly firing signals to each other across intricate networks, enabling us to think, remember, and perform everyday tasks. In a healthy brain, these neurons communicate seamlessly, allowing for efficient cognitive function. However, in a brain affected by dementia, this bustling city begins to experience blackouts. Neurodegeneration, the progressive loss of structure or function of neurons, takes hold. This process causes brain cells to deteriorate and die, disrupting the neural networks essential for cognitive functions. When these networks break down, it becomes increasingly difficult to perform even simple tasks. The damage results in the cognitive and behavioral symptoms characteristic of dementia: memory loss, confusion, difficulty in communication, and changes in behavior. The seamless coordination of a healthy brain is compromised, leading to the profound challenges faced by those living with dementia. Dementia can arise from various underlying causes, each affecting the brain in distinct ways. Let's delve into the most common culprits, shedding light on how they damage the brain and lead to the profound cognitive decline associated with dementia. Alzheimer's disease. Alzheimer's disease is the most prevalent form of dementia, accounting for 60–80% of cases. It is a progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out simple tasks. The disease is named after Dr. Alois Alzheimer, who first described it in 1906 after observing significant changes in the brain tissue of a patient who had died of an unusual mental illness. The hallmark features of Alzheimer's disease are amyloid plaques and tau tangles. Amyloid plaques are clumps of beta-amyloid protein that accumulate between neurons, disrupting cell-to-cell communication. These plaques can block the signals between synapses, the tiny gaps between neurons where communication occurs. Imagine trying to have a conversation with someone across a room filled with static noise. That's what happens to neurons trying to communicate across these plaques. Inside the neurons, tau proteins, which normally help maintain the cell's structure, become twisted into tangles. These tau tangles disrupt the transport system inside the neuron, preventing the proper movement of nutrients and other essential materials. This disruption causes the neurons to become dysfunctional and eventually die. Over time, the brain shrinks significantly and the damage spreads, leading to severe cognitive impairment and memory loss. The progression of Alzheimer's disease is often divided into stages. Early stage: mild memory loss, difficulty with complex tasks, subtle personality changes. Middle stage: increased memory loss and confusion, difficulty recognizing family and friends, agitation and wandering. Late stage: severe cognitive decline, inability to communicate, need for full-time care, and loss of physical functions. Vascular dementia. Vascular dementia is the second most common type of dementia, resulting from conditions that damage blood vessels in the brain, leading to reduced blood flow and oxygen to brain tissue. This can occur after a single large stroke, post-stroke dementia, or from multiple small strokes, multi-infarct dementia, as well as from chronic conditions like hypertension, diabetes, and atherosclerosis. Imagine the brain as a lush, green forest that thrives on a network of rivers and streams providing water and nutrients. In vascular dementia, these rivers and streams become blocked or narrowed, depriving the forest of the resources it needs to flourish. Similarly, when blood vessels in the brain are damaged, neurons are deprived of oxygen and nutrients, leading to cell death and impaired cognitive function. The symptoms of vascular dementia can vary widely depending on the areas of the brain affected. Common symptoms include Cognitive symptoms: difficulty with problem solving, slowed thinking, impaired focus, and trouble with planning and organizing. Physical symptoms: weakness or paralysis on one side of the body, balance problems and difficulty walking. Emotional symptoms: mood changes, depression, and apathy. The progression of vascular dementia can be stepwise, with periods of relative stability followed by sudden declines after additional strokes or vascular events. Lewy body dementia. Lewy body dementia, LBD, is named after the abnormal protein deposits called Lewy bodies that develop inside nerve cells in the brain. These deposits contain a protein called alpha-synuclein, which disrupts normal brain function. LBD can present with symptoms similar to both Alzheimer's and Parkinson's diseases, affecting cognition, movement, and behavior. Imagine trying to navigate a city where roadblocks and barriers appear unpredictably, making it difficult to move or think clearly. This is akin to what happens in the brain with Lewy bodies disrupting the smooth flow of neuronal communication. Key symptoms of Lewy body dementia include cognitive symptoms: fluctuating attention and alertness, visual hallucinations, and memory loss. Motor symptoms: Parkinsonian features such as slow movement, tremors, and muscle rigidity. Behavioral symptoms: REM sleep behavior disorder, where individuals act out their dreams, sometimes violently. One of the distinctive features of LBD is the fluctuation in cognitive abilities, which can vary significantly from day to day or even within the same day. Visual hallucinations are also common and can be very detailed and realistic. Frontotemporal dementia. Frontotemporal dementia, FTD, primarily affects the frontal and temporal lobes of the brain, which are responsible for behavior, personality, and language. The degeneration of these regions leads to changes in personality, difficulty with language, and impaired judgment. Imagine a conductor of an orchestra suddenly losing the ability to control the musicians, leading to a chaotic and uncoordinated performance. In FTD, the frontal and temporal lobes, which act as the brain's conductors for behavior and language, deteriorate, resulting in significant changes in how individuals think and behave. There are different types of FTD, each with distinct symptoms. Behavioral variant FTD, characterized by significant changes in personality and behavior, such as apathy, disinhibition, and inappropriate social conduct. Primary progressive aphasia, PPA, focuses on language impairment, with difficulties in speaking, understanding, reading, and writing. PPA can further be divided into non-fluent agrammatic variant, difficulty producing speech and grammar; semantic variant, loss of word meaning affecting comprehension and naming; logopenic variant, difficulty finding words and constructing sentences; movement disorders. Some forms of FTD can also affect movement, causing symptoms similar to Parkinson's or ALS, amyotrophic lateral sclerosis. Understanding these various causes of dementia provides insight into the complex and multifaceted nature of the disease. Each type of dementia affects the brain differently, leading to a wide range of symptoms and challenges for those diagnosed and their families. By exploring these causes, we can better appreciate the importance of early detection, targeted treatments, and ongoing research to address this profound health issue. While some risk factors for dementia, like age and genetics, are beyond our control, lifestyle choices can significantly influence brain health. Let's explore how we can empower ourselves through informed decisions. Cardiovascular health. Maintaining a healthy heart is crucial for brain health. Conditions such as hypertension, high cholesterol, and diabetes can damage blood vessels and reduce blood flow to the brain. Regular exercise, a balanced diet, and medications can help manage these conditions and protect cognitive function. Diet and nutrition. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports brain health. The Mediterranean diet, which emphasizes plant-based foods, fish, and olive oil, has been linked to a lower risk of dementia. Avoiding excessive alcohol consumption and smoking is also critical, as these habits can harm the brain. Mental stimulation. Engaging in activities that challenge the brain, such as puzzles, reading, learning new skills, and socializing, can help build cognitive reserve. This reserve acts as a buffer, allowing the brain to function more effectively despite age-related changes or damage. Social engagement. Staying socially active and maintaining strong relationships can improve mental health and cognitive function. Loneliness and social isolation are risk factors for cognitive decline, making community involvement and meaningful connections vital for brain health. Prevention. Adopting a brain-healthy lifestyle can significantly reduce the risk of dementia. Regular exercise, a nutritious diet, mental and social engagement, and avoiding harmful habits all contribute to maintaining cognitive function. Prevention starts with small, consistent choices that collectively have a substantial impact. Receiving a dementia diagnosis can be overwhelming, but there is hope and a path forward. Early detection and comprehensive care are essential for managing the condition and improving quality of life. Early detection. Identifying dementia in its early stages allows for timely intervention and planning. Healthcare providers use cognitive tests, brain imaging, and medical histories to diagnose dementia accurately. Early diagnosis also opens the door to treatments that can manage symptoms and slow progression. Treatments and interventions. While there is no cure for dementia, various treatments can help manage symptoms. Medications like cholinesterase inhibitors and memantine can improve cognitive function and delay symptoms. Non-pharmacological interventions such as cognitive therapy, physical exercise, and social activities also play a crucial role in maintaining quality of life. Support systems, caregivers, and support networks are vital in the journey with dementia. Family members, friends, and professional caregivers provide emotional support, assistance with daily activities, and a sense of connection. Support groups and community resources offer additional help and a platform for sharing experiences. Research and innovation. Ongoing research brings hope for future advancements in dementia, treatment, and prevention. Scientists are exploring new medications, therapies, and lifestyle interventions to improve outcomes. The growing understanding of dementia's underlying mechanisms paves the way for innovative approaches to combat the disease. Dementia is a challenging journey, but it is one that can be navigated with strength, hope, and resilience. It is a shared experience that affects not only those diagnosed, but also their families, friends, and communities. By fostering understanding, compassion, and support, we can create an environment where individuals with dementia can thrive.